Do you feel that using this kind of nomenclature makes it better or worse to communicate to the patient? Say if you say, we are going to give you a partial agonist, an inverse agonist, because we think that you deserve it. Your serotonin system is perhaps not working in harmony with your dopamine system. So we're going to give you a combined serotonergic, dopaminergic agent. Now, do you think that might be better to convey the message to the patient rather than using something that everybody understands, terminology that he could go up to the internet, search, Google it, and be able to perhaps understand it more in the kind of everyday language, antipsychotic, antidepressant?
It's a very good point. We are currently working on a version for patient and family. So basically the idea is, instead of patient going to Google or Wikipedia and get all this kind of frightening type of information from there, we are working now on having patient and family version. So basically by the end of the session with the patient, you can recommend to the patient to look, and this will be in his language. I think nowadays it's extremely important that to make sure that the patient understands what we are doing. If we don't provide him with this type of information, he's going to get it somewhere else. And many times what he gets is not accurate, is not scientific, and it's interfere with the adherence. So I think that this is the next step, and this is a very good point. We do need to do this. We try to forget or to repress the fact that many times, actually more than 50% of the time, the patient are not taking the medication as prescribed. So we can write the best medication for the patient, but if the patient is not taking them, then we are not doing anything, and we need to work on this domain, make sure that there is increased adherence, and the key for increased adherence is for the patient to understand why we are giving him the medication, and in this regard, what we are doing now, antipsychotic for depression, antidepressant for anxiety, is not helping us with the adherence. But it's a very good point, yeah. Yes?
I have a question. Would you recommend patients to use NbN?
We are working now on patient and family version. I think now it's too complicated. And we would like to have a special version that patients can download, patient and family version, and then I will definitely recommend them to use it, because it's going to talk in their language. And so they can understand it, and they can understand why we are prescribing this medication, why we ask them to take the medication for this period of time. It will help them to adhere to the dose that we prescribe and so on. I think it's a very important factor. As I mentioned, we tend to ignore the fact that many times patients are not taking the medication as prescribed, and we need to do something.
So I think, as you said, the layman's version probably is urgently needed. So when you say antagonist, agonist, it would be much better to say blocking the target, for example, stimulating the target. Instead of saying modulation, maybe it's better to say balancing, the circuits, etc. Something that you once mentioned, I think that is certainly very much needed.